Hello everyone. Let's go over muscles that move the thigh. First, let's not forget about our friends that are hiding posterior to the abdominal pelvic organs. We've got our psoas major and iliacus, together known as the iliopsoas. Psoas major, iliacus, they help you flex your lumbar Z joints, flex the vertebral column. Like if you bring your legs up, also can help you, flex your femoroacetabular joint, or flex your lumbar Z joints. Psoas major, iliacus. Going to the back, we've got this very large muscle, the gluteus maximus. This is an important muscle for things like squats. So you're extending at the femoroacetabular joint. So extension is backwards that way, posterior, as well as lateral rotation. Gluteus maximus, this muscle right here, this is your tensor fasciae latae. Tensor fasciae latae. I know, a long name. On this model, this is a lateral view of the left leg. Here we've got the gluteus maximus in back, posterior, a bit more anterior. Here's the tensor fasciae latae. Both the gluteus maximus and tensor fasciae latae, they connect at this tendon. I know it's not shown perfectly here. It's actually shown a little better here. Here's the tensor fasciae latae. Here's the gluteus maximus. And there it is connecting. This tendon connects all the way down up from the ilium proximal all the way down to the tibia. My focusing is getting all messed up. Let's try this one more time. Connecting from the ilium all the way down to the tibia. Tensor fasciae latae and the gluteus maximus share this tendon. This tendon is known as the iliotibial tract. You probably know it as your IT band. It's a very thick tendon, superficial to these muscles that you see here. Iliotibial tract, because it goes from the ilium all the way down to the tibia. Deep to your gluteus maximus, if I can pull this off easily. Deep to your gluteus maximus, you've got your gluteus medius and your gluteus minimus. Your gluteus medius and minimus are for abduction, so bringing your leg laterally out, and for medial rotation. So you can see a little bit of the maximus even with, you can see the medius even with the maximus removed, or not removed. So it is peeking out, but it does also go deeper. Here's the maximus. You can see the medius peeking out, but you can better see the medius if you remove the maximus. Medius, minimus. Muscles of the thigh, the inner thigh. If gluteus maximus and medius, if gluteus medius and minimus are for abduction, for bringing your leg out, how do you bring your leg in? We need muscles on the inner thigh, the medial thigh. This long muscle, shown here, straight and medial, shown on this model here, straight and medial. This is the gracilis. Think of this as your graceful, thin, slender muscle. Gracilis. It's not this very thin muscle that starts on the anterior side and then curves medially. This is a different one. We'll get to it later. It's a sartorius. This is just straight medial. That's the gracilis. These muscles on this side again are for adduction, for bringing your legs closer together. This muscle that you can see here, here's your knee. This muscle that you can see right here, this is the adductor longus. So it's a muscle that adducts and it's long. Starts here at the coxal bone, goes down to the femur. Adductor longus. adductor longus. Sorry, not this one, this one. Adductor longus, adductor longus. There are other adductors. This one back here, it's hiding, but this is all pretty big. It's starting here, it's also here. It's hiding underneath the gracilis. This is the adductor magnus. Magnus means big. There is also an adductor brevis, but it's hidden deep to all of this. So there are three adductor muscles that are called adductor. Adductor longus, adductor magnus. There is also an adductor brevis, which is shorter and deeper. So the adductor longus, magnus, brevis, and gracilis, they're all for adducting at the hip, adducting at your femoral-acetabular joint. Your adductor longus and your gracilis, they're also good for medial rotation. Adductor longus and gracilis are also good for medial rotation.